All patients are provided narcotic medication for use after the procedure. This is a painful procedure given the large number of nerve endings and sensitivity in this area, and medication is a big part of recovery. In addition, an ice pack to decrease swelling and discomfort is also well utilized postoperatively. Most patients do not require refills on the pain medication we provide. A typical postoperative visit is at about 2 weeks following this, where we assess when the timing would be appropriate for activation of the device. Swelling is best reduced by time as well as use of an ice pack. We strongly suggest an ice pack to be utilized initially postoperatively and to continue until any swelling issues have abated. All of our patients are provided written instructions for what to expect from the procedure, but specific to the incision site, our hope is that it is left alone. The incision site has some dissolvable stitching as well as some skin sealant over the top of it. We do ask patients to begin showering 2 days after the procedure, and often there is a small dressing over the top of that glue that is removed immediately following that first shower. The pump in the scrotum can be pulled down at any point in time. However, during our surgical technique, we actually suture the pump to where it should not ride up greatly in the scrotum, so our hope is that this won't have to be utilized. When we prescribe narcotic pain meds, we also prescribe a stool softener. We recommend this be utilized the entire time the narcotics are being provided. But if additional constipation concerns exist, please contact our office because we can also recommend additional remedies. From a bathing standpoint, we typically recommend beginning to shower about 2 days after the procedure. We do request that submersion tub baths or hot tubs be avoided for the span of a few weeks. We request that individuals do not drive while they're taking narcotic medications. As far as returning to work, depending on the job at hand, some people are able to resume desk-related or computer positions almost immediately. Others do need to be off work for 2 to 4 weeks, depending on discomfort and whether they have a strenuous lifting job. Recovery for the surgery is typically defined by discomfort from the procedure. That interval can be anywhere from 2 to 6 weeks. On average, a patient's recovery interval typically ends at about 4 weeks. Swelling that is not decreasing with an ice pack, fevers and chills, or any drainage from the incision site should be an immediate phone call to our office. But at any time, if a patient has a question about the procedure, our goal is to provide that support, and we would encourage patients to call at any time with questions. An appointment for postoperative care will be made at the time of the surgery, so every patient proceeding to the operating room knows exactly when they're going to be coming back for their follow-up visit. The device can be utilized after appropriate training is provided. We will assess every patient at 2 weeks to try to determine when that appropriate interval occurs. We do ask that patients not try to operate this device on their own without that appropriate training. At any point in time, our office can be contacted and we can triage every patient to the appropriate person to answer their questions. In addition, the representative from Coloplast is also available to answer some questions as well.